healthcare providers of Europe. Integrated community care means putting the patient at the center of your process and at the same time look at the community, look at the social determinants of health and see from the perspective of improving health you can address with other sectors the social determinants of health.
When I think about integrated community care, I think about all of the ways that people in communities, in neighborhoods, and in systems come together both to help people respond to the difficulties in life that can make it hard to be healthy and well, and also ways that people come together to promote health and well-being.
Integrated community care is trust, it's impact, and it's empowerment.
When I was a young person, I really struggled with my mental health. The help came for me when I was already thinking about taking my own life and ended up getting that help for the first time in a hospital-based setting. But every service was in a different place, on a different side of town. All of a sudden, I realized there was so much more work that had to come from me as a person seeking services than I really had energy for or support to do. It's an integrated team that makes sense, that takes that initial vulnerability from the young person or the family member or the caregiver before they're in crisis, before they're kind of at like stage 4.
When I think about strong examples of integrated community care, examples of care that are rooted in neighborhoods, that have a very strong sense of place and people, and know who it is that they're serving and why.
We create a space for the communities that we support to express their difficulties and express their needs. And from that basis, we create projects and actions that enable them to have a better quality of life. And in that way, they become actors of change, just as we are. Building resilience in communities enables them to fight for their rights, to seek for better social justice as well, because the more the people are able to voice out their needs, the more public health systems are able to improve.
One of the relevant aspects of the project is the collaboration. Person with present or past experience of mental illness who become a member of the staff. The fact that people with lived experience can be a part of mental health team is considered in the Untitled project an additional value and a resource that can give another perspective how the process of recovery can be and how to put the person in the center of their own process of care.
Integrated community care for us have the aim to support family, not only providing services for people with disability, and in particular for us as the children with disabilities, but integrate all the opportunities that the community can offer to create a strong alliance among different providers and to work on prevention of difficulties and promoting the well-being of people.
Evaluation is really important to integrated community care for a number of reasons. When we evaluate, we are measuring and assessing, ideally, what matters most to people. So it helps us keep track of how we're doing and helps us to be accountable, both with the resources that we're using publicly and also to the communities that we serve. We know that when communities come together, they're able to identify gaps or barriers in service at the community level, and they have a mechanism for bringing people together to solve those problems. We're seeing care providers experiencing a lot more satisfaction in their roles, and we're seeing communities achieving a greater standard of health.
The biggest misconception about integrated community care is that it is a kind of toolbox and that you use that toolbox to address problems from the perspective of different providers. I think we have to see it as an approach, as a vision, starting from the patient's needs and life goals, and then see how with our knowledge, with our expertise, with our energy, we can contribute to that.
My hopes and aspirations for the future of integrated community care is that it continues to develop. I think that in any country, in any territory, there are marginalized, vulnerable populations. And I really believe that empowering communities is key to fighting these inequalities. And I think that it's important that we have a strong backbone at the institutional level to have the financial support as well that we need to do the work.
Integrated community care is the future, is transformative, and is hopeful.